Hi Heather, I'm doing my certification video. My son Saxton's right there. We're ready to go. Okay. My name is Fatima Solaris. Welcome to Fascia Decompression. I'm your fascia master, and I will lead you through this practice. First, we're going to start on in the belly position, where the belly button resides, right in the core, that center. Come down onto your elbows first, slowly, guiding your torso up and over the block. Begin to connect to your breath, drawing in on that inhale. Notice how your spine rises to the ceiling, and on your exhale, belly button goes into the spine. Take another deep breath in, filling up, letting that spine rise, opening the lungs. Decompress. We're starting to activate the diaphragm. It creates this engine, the bellows, the massage of the internal organs. Opening and expanding the lungs, decompressing and closing the lungs creates this variance in the body to oxygenate, to come alive. We always start in the belly in this practice. We always start into the belly in this practice because the belly is the core. Of course, it's the umbilical cord, but it's a lot of vital organs here, reside here in this belly region. Our stomach, our spleen, digestion, all those intestines, the liver, the heart, the kidneys, the adrenals. And fascia holds all these organs into place. It embodies, it weaves and webs the network around every system, all the layers, anchored onto the bones. If there's any restriction in this area, it will restrict the vital function, the potential of all the organs related, and up the chain, down the chain. So we always start in the belly to begin to melt and decompress, to move this energy through the body so it can create function and provide. Stay here for a few more rounds of breath. Always make sure you're breathing in a relaxed manner so that you can feel your lungs. Anytime you notice your body being restricted or your breath is restricted, that is your indication that you need to modify, adjust. Eventually you'll get here. You're sitting with discomfort to find the comfort. At first, this area might be really intense, frozen, restricted, but you just stay still in it and you breathe. And over time, it begins to melt and you become so comfortable in this space. You might feel sensations run down your hips, your thighs, as the blood begins to flow, as things become activated. Just feel those sensations in your body, feeling into the body and being aware. Let's stay here for one more round of breath. Let's breathe it in for the count of 4. I'm going to ask you to root lock, engaging your PC muscles, your anus, rooting down deeper into the block and letting it go for the count of 6. Take another deep breath in, and on your exhale, come onto your elbows, engage your core, slowly move off your block. Nice. How did that feel?
Good.
Let's let's go ahead and just quickly feel your range of motion in your body. Maybe take some side angles, side lunges. At the end of practice, we'll see how our range of motion has freed up, expanded. It will feel so amazing in the body. Our next position, we're going to go into the diaphragm. So taking the diaphragm to the center, we can use it vertically or horizontally. Let's stay with the horizontal and on the second level up. Great. And you're going to bring that right underneath the rib cage. There's a little notch right underneath the rib cage. The sternum is outlined here, and then right into that notch, horizontally, you'll place your block and slowly make your way down, first starting on your elbows here. Finding that breath. Inhale and the exhale, and as you soften, as you start to be relaxed in that breath, you want to engage with that 4 count. Inhale and disengage with that 6 count. Exhale. Melting any restrictions in the diaphragm. The diaphragm is a band of muscle tissue that connects, or domes, in between the lungs and the heart on the top, superior and posterior. At the bottom, the liver resides. When you breathe in, the diaphragm moves down the torso, the abdomen, opening the lungs so you get all that oxygen into the body, into the cells, into all lobes of the lungs. And as you breathe out, the diaphragm rises, pushing into the lungs, the heart, to really squeeze it out, taking with it CO2, debris, all the exhaust, all the stagnancy. And then your next inhale is fuller, more expanded, oxygenating all the cells. This is what the diaphragm does. It assists all the other organs into their full potency potential. It rolls over the abdomen. It's the domain. That's why it domes. It is the dome. And you are the domain. How about that? Stay here for 2 more rounds of breath. Find little micro movements. Shear through all that layer of fascia. If there's any adhesions, feel into the pain. The pain is always the indicator there's a restriction, something that needs to be sat with, seen. In this practice, we are learning how to embrace the pain, the discomfort. This is where the true healing begins. Not running away, not avoiding it, but loving what is, addressing it. Let's do a guided round of breath together. Take a deep breath in for the count of 4. Hold, squeeze that root lock. Exhale, let it go for the count of 6. 5, 4, 3, 2, 1. Let's do that one more time. Deep breath in, count 4, 3, 2, 1. Root and let it go. 5, 4, 3, 2, 1. Next breath in, fill up. And on your exhale, begin to come onto your hands, engage your core, come up off the block. Nice. Let's go into our right pec. We've already done our left. We're going to start in on our right. So right pec, bring the block right below that clavicle bone into the tissue. Almost it's the breast tissue or the chest tissue. Both are the same. And then you're going to walk slowly, keeping your knees and your hips aligned. Hips right over the knee. And coming down onto that block. Resting your head heavy, letting gravity lengthen the back of your neck. You might even want to angle the block down towards the armpit, the bottom of the block down towards the armpit, just feeling into that tissue, seeing if you can feel any restrictions. I'm going to also explain to you the position of the tongue. The tongue's true aligned position is in and up in the roof of the mouth. There's a dome there, and the tongue rests perfectly, symmetrically in that dome. You'll bring the tip of your tongue back a few inches from your front teeth, and this is home. This is where the tongue should reside, especially when breathing in this Ujjayi with your mouth closed breath. Your mouth is open, your tongue falls out of place. This will keep your proper alignment. It lifts your head, it lengthens your neck, and keeps the spine in that perfect alignment. You can even push in and push your tongue into the roof of your mouth. Your pineal and pituitary gland is right above this mound of tissue. That's its residing home, and you can use your tongue to stimulate and activate this area. So if you can find any resistance or adhesions by making those slight micro movements side to side, maybe taking a nice rotation, nice and slow, getting really familiar with this area of the body, how it connects to the shoulders, how it is the shoulders, a pectoral girdle. Those muscles provide extension and pronation, elevation in the body, in the arm. This area gets restricted, it leads to frozen shoulder, affecting the joints, the mobility in the shoulder and the arm. Even in your hands, articulation. It's all connected. Let's stay here for one more round of breath. Our next breath, I'll guide you through that 4-6 count. So take a nice deep breath in. For the count of 4, hold root, keeping that tongue at the roof, and exhale for the count of 6. 5, 4, 3, 2, 1. Nice. Take a full breath in, and come up off your blocks. Push your palms down, engage your core as you push your hips back. Nice. Go ahead and take a nice articular movement, rotation. Feel that freedom in your chest. So what's cool is every time my son does block with me, his sinus is open. That just shows you how the fascia is so connected to the sinuses, and elimination and wanting to cleanse the body. And that's what we're doing with our breath, with our decompression, the tool. We're cleansing, feeding and cleansing the body. Our next position will be the left anterior waist. So we'll be coming onto our left side, bringing the block with you. So right underneath the rib cage, there are two floating ribs. And it's the soft part of the belly, right in between the iliacus bone and the lower ribs. If you can feel those. And so you're just gonna come down first onto your elbow. This can be pretty intense area. This and the IT band are the ones that get most. We get so compressed in the abdomen just from improper posture, breathing, not using our diaphragm. This all gets congested and frozen. We're thawing it out, going into our breath. Engaging that diaphragm to massage these internal organs, to get things moving, the lungs open, reaching those deeper levels in the lungs, those alveoli, oxygenating all the cells in the body so we can come alive and be free in this body. And our exhale is to cleanse and release. And you start to melt that tissue and it starts to feel warm. You'll begin to sink more deeply into the block. Maybe you come down onto, you can maybe come down. You might get to the part in this practice where you're all the way down, resting your head onto the mat. Yeah, always use your breath as your guide to let you know where you can go and where you need to be. As you breathe in, feel your belly open and dome out, just like a balloon. As you exhale, belly comes in. Focus that belly button out and back in. Bringing your awareness to the belly keeps that diaphragm engaged. One more minute here. See what sensations are showing up in your body. Any electrical impulses, any warmth, any floods of memories, thoughts, emotions. Sit with it. Embrace it. This is how the healing is done. Be the greatest investment you do for your body, for your mind, for your soul, is coming into union and breathing into this practice, feeling it all, experiencing the fullness. Go ahead and take those 3 more rounds of breath before I guide you in and out of the practice, or this position, I should say. Find any extra micro movements. Maybe you take a movement forward, an inch back. It's where your spleen resides, stomach, portions of your stomach, a large portion of your stomach, your heart, pancreas, kidney, left kidney, all of these organs you're massaging, releasing any restrictive frozen bands, melting that so they can function properly in harmony with the body. Take a deep breath in for the count of 4. Engage that root block. Lock the tongue at the top of the mouth. And exhale for the count of 6. 5, 4. Push it all the way out. 3, 2, 1. Take a full breath in. Feel those lungs expand. And on your exhale, engage your core. Come up and off your block using your hands to assist you. Nice. Let's go right into the head and neck mantra. We're going to do the right deltoid. Do you know where your deltoid is, son? Yeah, so we're on the right deltoid. Go ahead and take your block. You might even want to use your block baby. So these are the 2 blocks we use in practice, the block buddy, the block baby. This might actually be a little bit more intense because it's smaller and really gets into this area a little deeper. So coming onto your side, we're gonna just begin to lay down. First come onto the elbow, and then we'll lay that deltoid right on top of that block. Maybe you lift your hips up and get really positioned. Nice, let your head hang heavy. If you have a pillow here or would like a pillow, would you like a pillow?
Use the
other block? Awesome. This is how you can even multitask. You can use the other block as your pillow and get into that temporal bone and all those attachments, those sutures in the head. As you bring attention to the deltoid, you can also bring attention to those sutures, the skull, all the fascia winds everywhere. Stay with that breath. Make sure you're breathing. That's why it's nice to have a facilitator during, you can do this at home on your own all the time, but sometimes when you really start getting into it, you go into a trance, like a meditation, and your breath just goes back to that autonomic response. Whatever rhythm is in your body, pattern, it will go back to that. And with a facilitator, you can always, she or he always guides you back into that full breath, repatterning your breath into the fullness of your breath. So you don't go back into that old pattern. We're creating new patterns, new pathways. And it's nice to have a facilitator for that until you really get it all connected, downloaded. We always want to stay in position for at least 3 minutes. This is where the process really gets activated, gets set, gets reprogrammed. And anything after that is just icing on the cake, I should say, or cherry on top. It's just an added compliment, bonus. But once you've reached that 3-minute threshold, everything, the motion, the potential is in action, in progression. The reprogramming is being done. This is a practice you use for a lifetime, because life is always going to show up and throw different things your way to help you expand and grow. And it's a beautiful thing, no judgment in it. It's just when you get locked into it and wounded and develop a scar, hence scar tissue is fascia. That is a wound, an injury that has occurred, and that tissue is frozen and scarred and healed over, creating that wound. The wound is still there. If you haven't addressed it, learn how to release it, free it up. And this practice gives you the tools to do that. fascia is the mother of holding all of the stories, all of the wounds, the injury. One more minute here. Nice breath, Saxton. Really tuning into the body, feeling all these sensations. Take any micro movements you need, addressing any areas that you weren't even aware of, really investigating your body. This is an opportunity to get familiar with the body. Let's take a deep breath in for the count of 4. Nice hold at the top. And let it go for the count of 6. 2 more times like that. Breathing in for 4, 3, 2, 1. Rooting down, locking that tongue at the roof. And letting go for 6, 5, 4, 3, 2, 1. Breathe in for a full count of 4. And hold. Let it go for 6. And on this time, just take an inhale in, and we're going to exit off the block with the exhale. Pushing up into that hand. Nice. How did that feel?
Good.
Now make sure it's placed at your side so you can reach it. Go ahead and come onto your elbow. Bring your fingertips towards your knee. Articulate that wrist down. And you're going to sandwich your block in between your lower rib cage and your forearm. You're going to use your body weight, gravity, to decompress, to hold pressure into the forearm, to sink into the forearm. Go ahead and open and close your hands. See if you can feel that pressure and feel the resistance. Feeling this area, take nice little movements back and forth. Can you feel it?
Mm-hmm.
Okay, good. Stay in your breath. I want to hear you breathe. I want to see your spine and your stomach moving. These subtle movements is what creates the heat, the furnace in the body to begin to melt these adhesions. Remember, keeping your mouth closed so you keep the heat contained within the body so you can really alchemize and create the right temperature so it can melt. You want to use your exhale to move the pain out of your body, to move the discomfort out. After you've sat with it, breathing it in, sitting with it, being aware, you can use your exhale to move it out, to cleanse, to purify. When you're frozen, you're imprisoned. In this practice, we have the keys and the tools now to release that imprisonment, to let go of that imprisonment. This is freedom. finding bliss in the body. Restrictions in this area lead to carpal tunnel, arthritis in the joints of the hands. You can get to this area and address it here, releasing all those restrictions. You let the blood flow into the joints. You let the fluid be fluid and not be inflamed and irritated. Arthritis is just inflammation, irritation in the joints. There is a root cause, but right now we're just working in the pain and the anchor, and when we sit there, it will lead us back to the core, the cause. This is a meditative practice also. Teaches you how to start communicating and listening to that inner voice, that inner wisdom. Stay here for 3 more rounds of breath. Maybe open and close your hand. When you inhale, you open. I know I said 3 more rounds, but let's see this practice, see how this feels. So inhale, open the hand. Exhale, close the hand. Inhale, open. Let's do this for 3 times. And exhale, close. Inhale, open the hand. Really open it wide. And exhale, make a fist. Let's take 1 more breath together. Count of 4. Root. Take a nice root, really engage. And let it go for the count of 6. Take a deep breath in and exhale up and off. Exit your block. How did that time feel for you?
Good.
Didn't go over too much. Yeah, open your and close your hands. See how that feels. Do you feel that freedom already? Mm-hmm. Nice. Okay, let's go on the right side next. So coming on to the right hip. You're gonna place your block so it's at its highest point. And come down onto your elbow. We're just going to go right underneath the ear. You'll feel the jawbone. So there's your jawbone. Can you feel that?
Mm-hmm.
And just right underneath the ear, like just let it, there's a saddle. Just fall into that little saddle there. Get comfortable. You're going to make sure your block is right underneath that occipital bone. And that is in the back of your neck or your head. That's your skull, the bottom part of your skull. This can be really relaxing and meditative. Stimulating that vagus nerve, which is your rest and digest nerve. Puts your body into a relaxed automatic pilot, a resting state. All your organs take turns through the cycles of the day of rest, digest, and activate, and it starts all over again. Activating, resting, absorbing, digesting. See if you can find those little micro movements, any adhesions and the sutures of your skull, the bottom of your skull into the jaw, of people who have migraines and congestion in this area will have migraines because there's not adequate amount of blood flow up to the brain. They have just headaches, tension. And the ear canal is affected, the jawbone, T and J here. That fascia creates a thick band that goes up and over the skull, into the face, jaw, chin, down the neck. When the ribs are collapsed from improper breathing and posture, the neck takes the burden. The head weighs about 10 pounds. And when you're out of alignment, the head now weighs about 100 pounds tilted off its axis. And the rest of the body down the chain takes the brunt, messes with your posture, your gait when you walk, the compression in your abdomen. You begin to spiral forward and down, thus even creating a hump on the back. And this all gets patterned in to the body. Keeping that tongue rooted in the roof of your mouth helps to keep this alignment. Staying connected to your breath, being aware of how you breathe and how your belly expands and contracts, keeps you into this alignment. And even rooting throughout the day to keep everything pulled up and centered will help you stand tall and lengthen and stay open and balanced. This brings harmony to all those internal vital organs, to all the cells, all the structures, all the layers. All the systems, your respiratory, your digestion, your nervous system, your lymphatic system, all affected, all working together. Stay here for 3 more rounds of breath. This is such a relaxing, getting into that parasympathetic system. We're really going into a deep state here. You could be here all day. You could probably sleep in this position. I know I have. I'm going to guide you out, in and out through the next 2 rounds. So take a full breath in for the count of 4. Really root, tongue at the top, and let it go for 6, 5, 4, 3, 2, 1. Breathe it in for 4, 3, 2, 1. Root, and let it go. 6, 5, 4, 3, 2, and 1. Squeeze it out and take a deep breath in and begin to come back onto your elbow. Engage your core to lift you up and off. How is that, Saxon? Wow. It is the medicine. Okay. Let's go into our last 3 segments, Saxton. We're doing it. We're gonna do, this is in the pelvis, the leg module. We're gonna do the left hip. We've already done the right. So we're gonna do the left hip flexor. So coming onto your left side, Yeah, get on your left hip, sweetheart. Okay. So, left hip flexor. Put your block on the middle layer, Sax, to where it's horizontal to your mat. So, have to just look at everything for a sec. So your left hip flexor is that bone. It's attached onto that bone on your left hip. Yeah. And we're gonna go right on top of that bone. It can be really intense. So let's take it nice and slow, exhaling down, down onto the block, onto your hip. You're gonna be on your, oh, yep, on your left side. This is the left hip muscle. Your psoas muscle is right underneath the iliacus. And come over onto this your side. So your block is on the bone, but a little into the tissue of the psoas in your stomach.
More up or on my glute, kind of?
No, up. It's going to be more up on this bone, almost in, yeah, right in there. That's a good location. Just a little bit above the hip bone, but on the bone still at the same time, if that makes sense. And you can just bring your shoulder and elbow to alignment, and can kind of lift the knee, the bottom knee, just a little bit to really get on top and center of that block. How does that feel? Can you feel?
Yeah, I can feel it.
I just got an adjustment. That must have been a part that was pulling me in out of alignment, and just adjusted, just from being right here.
So am I supposed to be leaning forward or backwards?
I'm more lean forward because we're gonna use our other hand, put both hands down and roll into that area where the psoas is on the left side. Yeah. You might even straighten your leg here. The bottom leg, straighten it, because we're rolling slowly into this area. And let the corner of your block really dive deep into that tissue. Like you find yourself melting it even a little bit more and might go into that psoas region. And this fascia band connects the rectus femoris, the sartorius, all the dinosaurs of the thigh, all those muscles. This is the ASIS bone. And find those little micro movements, feel those adhesions. So many people have lower back pain, and it's this psoas muscle in here that's been restricted, injured, or bound. I know C-sections really cut all those muscles, and there can be a lot of low back pain associated, hip pain associated with all the scarring of the tissue of that injury. Make sure you're breathing in and letting your spine lift to the ceiling. So you can really play with the block here. If this already feels intense, then stay here. We're just melting. But another position I'll show you while you're on your block is coming. So this is the lowest position, middle position, highest position. So you could even go here on that middle position. You might want to play with it. Always just remember to exhale out as you come up off the block. And this gets deeper into that psoas muscle. And still one edge of the block is in the bone or on top of the bone. And then the rest of the block melts into that soft tissue here. What does that feel like?
So this part is like where my bone is going to be like,
yeah, and,
and then this part is going to be like,
yeah, more into the psoas.
Oh.
Nice and slow. And maybe you take nice little rocking movements. I mean, inch by inch, up and down, really feeling, getting familiar with this area. This area affects the stomach, the bladder, the sex organs to the left of the body, the reproduction in the left, those testes, ovaries, the fallopian tube, the bladder, like I said, everything is affected here. The ascending colon, I believe, is on the left, and on the right is descending. The kidneys, the ureters, everything is all housed here. If there's a restriction in this, in the muscles, even psoas, the fascia, is all being imprisoned, frozen. Things aren't functioning fully. So it affects the way you walk, the way you sit, your posture, your elimination and absorption, and your vitality and fertility. It's all connected. All these different systems, functions. See what sensations you feel here. Your hips are your relationships. Your hips are in relation to the relationship you have with yourself. If you have pain in your hip, then that's an indication that there's something you need to work in within you. Not externally, internally. And the left side is your feminine, the right is your masculine. And I could talk about that forever, but I'll leave that there. We'll do that in the next session. Meditate with this information. Information. Stay here for 3 more rounds of breath, searching for those areas of pain, discomfort, and sitting with it. Use this rejuvenation of fluid to cleanse and to release, to melt away old stories, old patterns, injuries, wounds. This is medicine. This practice is medicine. Some of the best medicine you'll ever get. This is where you get to show up for you and do the work. Let's take a deep breath in for the count of 4. Root, lock it in, and exhale, let it go. One more time, deep breath in, count of 4. Root it, and let go. Let's take a deep breath in, and on your exhale, you'll slowly come up onto your hands and push up and off your back. Nice. How did you like that position?
Very good.
Very good. Good. Now we're going to go into the right IT band. So coming onto your right side, you're going to come down. Well, actually, let's stay up on our knees. This block will be coming, you could lay it flat. These are our 2 positions we'll use it. You can lay it flat. I'm going to just start with laying it flat. We're going to start with the bottom because this is very intense. So you're going to come down. The block will come up, up about right in between your knee and your hip bone. So find that middle area, almost like teeter-totter over the block. And then when you get there, you can come down onto your elbow. You can bring the top leg up and over to hold you in position, or you can bring it back, whatever feels good in your body. You just want to get stable. You want to get comfortable and grounded so you can stay here and breathe in that relaxed breath, you know. Use your breath as your guide. If it feels uncomfortable, adjust, find your adjustments. You can even use a rolled up towel if this feels too intense, because this area is intense. It's this thick band of fascia that runs from your knee joint or your knee bone all the way up to the hip bone. Keeps the posture, the leg, in its proper alignment. This gets injured a lot due to the lack of fluidity. Being too tight. All these athletes aren't fully hydrated. This tissue is frozen and stuck. It could be numerous amounts of reasons, but it hasn't been addressed. It's been avoided. And when they go into these extreme sports, it's the one that gets injured, ripped apart, fractured. You might even play with bending and straightening the knee, just like you started, just to really get to melt into the layers. To be more mobile on it, you might even just come back up onto your hands, and then you can play with this a little bit more, shearing, using your hands to support you as you shear into different areas, and then bending and lengthening the leg, whatever feels good or uncomfortable. You sit in that. You can even twist to the front of the thigh, really shearing. Find small rotations. Let's just stay here for 3 more rounds of breath. Connecting to that breath, becoming aware. Do your shear, do your grind, twist, torch, shift. This band of fascia is connected to the femur bone, the largest bone in your body. It's got a huge responsibility. Let's go ahead and take that nice deep breath in for the count of 4, holding, rooting, and let it go for the count of 6, 5, 4, 3, 2, 1. Take a deep breath in and roll up and off your block with your exhale. Our last position. Let's do the foot. We're gonna get the toes. So we're gonna do the left foot. So we already did the right. So let's hold on to our left foot. Fingers open, go into the opening of the toes. The only finger out is the thumb. Go ahead and sandwich those fingers, knuckles and all the way in there. To the base of the toes. Nice. How does that feel in there?
Uncomfortable.
Oh yes, it's gonna feel real uncomfortable. Our shoes squish our feet. Been wearing shoes pretty much from day one, some of us, and it's not good for the fascia of the toes. I'll tell you that. Anyways, let's begin. Coming into your breath. And yes, my son decided he was going to do both at multitasking. That's what I'm talking about. This is great. And a hip opener. Okay, let's do our breaths. Inhale, letting the spine expand. Keeping that heat in the body. Closing the mouth as you exhale. Bringing that belly button into the spine, really pushing out all that exhaust, that waste, that debris. Breathing in all this new energy, this light, this activation, and letting it go. To be absorbed, to be shared. Breathe in. Decompress, let it out. Try to really accentuate on the exhale. That really pushes out all the stagnant, the sediments that's been settling for years and years and years. Bringing that all up to the surface so it can be released, let go of. And play with your hands a little bit. Maybe you start to curve your toes down towards the floor or each other. You got your hands in both of your feet. You take nice little rotations, feeling all of that. Like, people are so unaware that their feet even have these feelings in them, you know. You get so used to being frozen and restricted and taking the feet for granted. You don't realize how important these feet are. They want to feel and be alive, to feel the grass under your feet, to walk in the sand and the mud, to feel the waves come in. They're what ground us, keep us standing upright, moving us along on our path. Stay here for 2 more rounds of breath. Maybe even straighten your leg and bring those toes up. See how that feels. Really getting your elbows into that fascia. Using the bone on bone. Breathing. Ooh, that is intense. I feel it. Take a deep breath in, root, and let it go. 5, 6. deep breath in and exhale. Letting your fingers come out of your toes. Our next position will be with our block right in the inside arch of our foot. We're going to bring it to the alignment with the ankle of our foot. And so you're still on the left foot, Sax? Yes, you are. And so it's on the arch and the ankle bone at the same time. And using your top knee to apply a little pressure. You could take some nice rotations, really filling into both areas. Getting into the bones of the top of the foot. There's a bone that really sticks out towards the edge, medial edge of the foot. Can't remember what it's called. But on my foot, it's pretty pronounced. Take some nice little rotations. Make sure you're breathing, staying engaged with your breath. Maybe you close your eyes, keeping you into the practice. Keeping it meditative. When you breathe in and out of your nose, you're getting 600% more oxygen to the cells. I didn't know that was such a thing until I met Deanna. That's pretty impressive. Tells you how important it is to really go always back to that inhaling in your nose and out your nose. There's little probably nerve fibers. Well, there's nerve fibers all over in your nostrils, but you have these hairs that filter in the air before it enters your body. So the hairs in your nose are actually filtering systems. And not only does it filter, but it warms the air as it comes into your body, creating that heat, that furnace to keep things moving and flowing. Stay here for 2 more rounds of breath. In your practice, you can also take this block up further, right underneath that big toe, and get in there, and you can bring it down towards the heel. If we did all things feet day, we would get into all those different angles. But for today, we're just gonna really just do some primary points, just to show like the different adhesions in the feet and to wake up the feet. Deanna always talks about death starts in your feet, so it's always an important in every practice to facilitate some portion being addressed to the feet. Okay, let's move. Let's take a deep breath in, filling up. And exhale off the block. And that is a wrap for our feet. What do you think?